Hello, my name is Valerie, and I'll be conducting your interview today for the position of medical office assistant. I'm going to ask you a series of questions, and I just want to get your opinion on some things, see how you react to some questions that I ask you. Okay? All right. Let's get started. My first question is: share with me your medical office assistant experience, and include your externship and your education that led you this position. As a medical office assistant, I have almost 2 years experience. I work in a occupational medicine clinic right now. Like I said, I've been there for almost 2 years. Um, so I do front and back office. I do have a coworker, and we do. I mean, we do everything. We don't like, oh, you do the front office and I'll do the back office. We do everything. Um, so what we do is we schedule the patients. We bill. We have a employee health clinic um, for who we work with, and the employees of the clinic that we work for, they come in for sick visits or whatever, they, UTI or whatever, and we would have to bill them and their insurance. And that's the only time that we do that is with our employees. Um, we usually, occupational medicine is workers' comp. So we get people who were injured on the job, and the companies are the ones that are being billed for the services. They have their workers' comp insurance companies that they work with, and we bill them. My externship was really good. I really liked it. I really enjoyed it. I was at Village Family Practice. It was considered a family practice clinic, but I did work with a variety of doctors. I worked with one that was specializing in geriatrics. I was working with a OB doctor and just the regular family practice physicians there. Um, they had me doing vaccines. They had me rooming the patients. They had me documenting anything that needed to be done, scheduling the patients, calling the patients, and making sure that they got their lab results, and um, if they needed to be referred to X-ray or MRI or anything, they would have me do that. Um, my education started with at PMI. I took the medical assistant course. It was a 9-month course, and I really enjoyed the teachers. They were really helpful. Um, uh, they helped me a lot. I really thought I couldn't do it, and they got me. They made me say quitting is not an option. So that's how I feel about that. Okay, so next question. When working with patients, what strengths serve you best? My strength is I'm a people person. I love being around people. I love taking care of people. It just makes my day so much better just to be able to know that I helped that person today. Um, and it really, this is from the heart. I really love being in the health field where I can help people. Okay. All right. So, next question. If you had to draw from a patient with the fear of needles, how would you proceed? This is kind of tricky. So, I would talk to the patient first. Just have a little chat with them, calm them down. Um, they already have their mindset that they don't like needles. Um, so you can't talk them into it either way. You can't do it. You can just calm them down, and you can ask them, okay, so if you don't want to look at this, you can turn your head. You can get on your phone and do something on your phone just to distract yourself, and then I'll draw your blood. So that's usually what I try. I just try to calm them down, try to get their mind, redirect them, and it usually helps. It really does. Okay, all right. Um, Tell me about a time when you had a challenging situation with a patient, and what was the outcome? Well, I can say with COVID right now, the most challenging situation is to have to test a patient who would possibly have COVID. The challenging part about it is that their nerves are shot. They're worried, and they don't know what to do. They think they hear all the negative stuff on TV, and they think it's going to happen to them. And you can't promise them that it's not going to happen to them. You can't do that, you know. But you can just let them know that you're there, and that if you need to talk, you can call the office, and you can either talk to the provider, or you can talk, to anybody, just to know that there's somebody there that will listen. And usually, when that happens, they calm down, and they were like, oh, I know, I'm just so nervous, I just don't want anything to happen to my family. I don't want nothing to happen to me. Everything, it's just so scary. And so that's how the outcome would come. All right, number 5. How do you handle the pressure working in a fast-paced medical environment? I like working in a fast-paced environment. For one, it makes the day go by faster. But it just gives you a rush, and you're able to get everything done. You're able to take care of your patients. You're able to get all your paperwork done. I'm not saying it's a good day every day. We have our bad days, but fast paced is like something that I just want to do. I love it. I love the adrenaline. So I have no pressure. And if we do get busy, like I said, I have a coworker, and we talk to each other, and we let each other know, hey, I just need to take a break, take a walk outside or something. And she's like, okay, go take a break, go take a walk, and I can handle it while you're gone. So yeah. Okay, so number 6, if a patient would suddenly fall unconscious, how would you handle it? First of all, I would make sure that they are comfortable, where if they landed on the floor, make sure I put a pillow underneath their head, make sure they're breathing, make sure there's no injuries to them anywhere, there's no blood or anything. If they are awake, kind of like in and out, I would we carry mobile phones with us, so I would call the provider to come to wherever the patient was at. And if it's even more serious than that, I would dial 911 and have the paramedics come. They're more experienced with that. So that's how I would handle it. All right, number 7. When counseling a patient, what is your main priority? My main priority is that the patient is understanding what I am telling them. I make sure I stop in the middle, in the middle or in between, and I ask them, "Are you understanding this? Do you have any questions?" Um, and if they do, I try to answer the questions that they have. So my main priority is the patient and their understanding of what's going on with their situation. Okay, number 8. Are you planning to continue your education in this field of healthcare? I am going to continue my education. This is just a stepping stone. I have always wanted to be a registered nurse, and I am going to do what I need to do to get there, and there's nothing stopping me. I'm not going to rush into things. I'm going to take my time because I know being a registered nurse or going to school for a registered nurse takes a lot. So I want to make sure I know what I'm doing before I take that leap. But yes, I am going to continue my education. And so a medical office assistant is one stepping stone, and I'm going to keep going from there. Okay, number 9. How much experience do you have with the EHR system? So the experience I have will be right at 2 years. I have never worked in a medical field, but I am getting the hang of everything. I mean, they change stuff up every now and then. So once I learn something, it seems like there's something new. But I take my notes and I ask my questions, and I get my answers because I have to know this. I have to. And the EHR system that we use now is really good, and I understand it really well. So my experience is at 2 years, and I know what I'm doing. Okay, so number 10. What do you like most about being a medical office assistant, and what do you like least? Well, like I said before, being a medical office assistant, the best thing I like about it is because I like to help people. I love being able to see patients every day and, find out what they need. And I really enjoy it. I really enjoy being in the healthcare system. It's been a dream of mine forever, and it's awesome. You asked what do I like least about it. There's nothing that I don't like about it. Nothing. I love my job. I love helping people. And I just can't wait until I get up there to be a registered nurse so I can do even more. Okay, well, the interview is finished. I will take your answers, and I will go and speak with my manager about this, and we will get back to you and let you know the outcome. Thank you for coming today. I really appreciate it. Bye.